Now, the number of new UK coronavirus cases has soared by more than 6,000 in the last 24 hours, up to the number of deaths and those needing hospital treatment. 6,178 people tested positive for the virus across the UK. That's a sharp increase on yesterday. A further 37 deaths were reported, taking the total to 41,862. Not the numbers anyone wants to see, as ministers insisted the stricter measures announced yesterday were enough to curb the spread of the disease, despite misgivings by some leading scientists. During the pandemic, 500,000 patients in England have waited more than 6 weeks to get conditions like cancer and heart problems diagnosed, with fears that people won't come forward for treatment as hospitals battle to clear the backlog. Our health and social care editor, Victoria Macdonald, has been to University College Hospital in central London, where staff are working to make sure all patients can be treated during another surge of COVID.
This is a hospital bracing itself, as they are right across the country.
The virus has started to spread again in an exponential way.
If we don't do enough, the virus will take off. That is the path that we are clearly on.
The respite has been shorter than had been hoped. And today more warnings are being sounded. The Royal College of Surgeons of Edinburgh describing the catastrophic impact of pausing operations again.
It is generally acknowledged that that slogan right at the beginning of the pandemic, protect the NHS, did have adverse consequences. Too many people with suspected cancers or heart disease stayed away. And now, as we see the COVID-19 cases beginning to rise again, hospitals are really concerned that that does not happen again.
And this was even acknowledged by the Prime Minister last night.
If we let this virus get out of control now, it would mean that our NHS had no space, once again, to deal with cancer patients and millions of other non-COVID medical needs.
500,000 patients are now waiting more than 6 weeks for a diagnosis for cancer, heart attacks and other conditions. Hospitals are struggling to clear the backlog.
What we need to do is make sure that we continue to run our services. So that means keeping them running on safe locations, putting in place testing where necessary, making sure the guidelines for patients are really clear. We've done this and we've been doing this for the last few months. So a lot of it is just about sustaining what we need to do.
University College London Hospital had to close wards and theatres to take in COVID patients, but they point to the endoscopy unit, critical for diagnosis, to show how you can keep a unit safe and running.
It was a big challenge. We reduced activity a lot. We kept 2 rooms running for kind of urgent and emergency patients. The big immediate challenge was the PPE and the amount of changes that we needed to put in place for that. We did manage to do over 1,000 patients during the peak of the COVID, and we followed up all of those patients and not one developed COVID symptoms, which was great.
Are you in recovery now? Right. Did you have any concerns about coming into a hospital and whether you would get COVID yourself?
Yes, absolutely. We'll find out whether I do or we don't in a couple of weeks' time.
Dr. Neil Navani gives the example of lung cancer. GP referrals, he told me, fell by 75% between March and June.
We recognise a real overlap in symptoms between lung cancer and COVID-19. And this has understandably caused considerable confusion amongst the public, but also healthcare professionals as well. Fever and loss of smell and loss of taste, that would make it far more likely to be COVID-19. However, if cough and breathlessness lasted for 3 weeks or more, we would very much encourage that person to see their healthcare professional.
Judy Miller's lung cancer was discovered just before lockdown, and the operation took place at UCLH, days before the pandemic peaked.
Were you worried about COVID?
Not really. I don't think I was. I took the precautions, I wore the mask, I went with a friend to the hospital in her car with the roof open. I was in a hospital which I had been assured COVID-free. was so early on in the lockdown that we hadn't had a lot of the scare stories at that point, because some of the stories do seem to put the fear of God into people.
In fact, Ms Miller said she was more scared of what was going on inside her body than of COVID, which could be a good message for the NHS to encourage people back across the threshold when they really need to be there.
Victoria Macdonald there. Well, go back to work. No, don't go back to work. Go on holiday. Stay at home. Eat out to help out, but pack up by 10. Little wonder, perhaps, that many people are finding the government's messages for England a little confusing. And that's before you try working out all the different rules for areas under local lockdowns. So first, let's look at the advice about whether we should work from home or return to the office.
I must give the British people a very simple instruction. You must stay at home.
The initial advice was clear, and most took it. City centres soon emptied out. But as the weeks and months passed, in England, we were encouraged to return.
Employers working with their employees should be encouraging people to get back to work.
By September, city centres had started to fill up, despite some local lockdowns.
People are going back to the office in huge numbers across our country.
But less than 3 weeks later, another change of heart.
Once again, asking office workers to work from home.
As for our social lives, just before lockdown, there was this request.
You should avoid pubs, clubs, theatres.
4 days later, it was last orders.
We are collectively telling cafes, pubs, bars and restaurants to close.
Then they reopened on Super Saturday, July the 4th.
Does it feel like lockdown's over for you?
Yeah, it does.
And a month later, the Eat Out to Help Out scheme launched. Thousands flocked to restaurants for discounted meals. But lockdown wasn't over. And last night, another change for England and Wales.
So today I set out a package of tougher measures in England. Early closing for pubs, bars, table service only.
Well, it took barely a few hours for the Welsh Government to change one of their central messages last night, requiring restaurants and pubs to close at 10 p.m. After an outcry from the hospitality sector, who said it would be crushing for some businesses, the First Minister has made a significant change. Our Home Affairs correspondent Andy Davies is in Cardiff. Andy.
Well, good evening from a very wet Cardiff city centre where I'm surrounded by pubs whose managers, no doubt, are bracing themselves to navigate the latest set of guidance. Interesting development, this one, because yesterday we heard from the Welsh Government a series of national actions, one of which looked initially like it was going to mimic one announced in England. That was when Mark Drakeford said that bars, cafes, restaurants, casinos had to shut by 10 p.m, fuelled, of course, by concerns over alcohol undermining social distancing rules. But then this morning the position had changed and Mark Drakeford was saying, actually, it's last orders by 10 p.m, not everyone out by that time. And it appears that late into the night there'd been lobbying by the industry who'd been arguing that you can't have 2 evening sittings with the COVID protocols and get everyone out by 10 p.m. And that was an argument, clearly, Mark Drakeford had sympathy for.
I didn't want to have a situation in which that would be impossible, and the business model that people have built up in Wales became, null and void. Those businesses have generally worked really hard. They've had a real struggle this year. I wanted a system that was sympathetic to their needs.
So, Andy, a bit of a win for the industry then?
Well, the Welsh Independent Restaurants Collective, which represents 300 businesses, said it will help, but it's a chink of light in a very dark picture made worse by ambiguous messaging on essential travel. And that's a reference to one of the other announcements made by the Welsh Government last night, which urged the people of Wales to travel only when necessary. Advice, not formal guidance, but it's led to all sorts of questions now about how do you square that advice with all the other things you're allowed to do in Wales. And on hospitality, Mark Drakeford said, well, try to keep it local when you go to a restaurant or pub. That same industry body said, that's just going to be the final nail in the coffin for many in the industry. So it serves to illustrate just how much pressure this industry is under right now across the UK and how sensitive it is to these various political decisions being made on its behalf.
Indeed, Andy, thanks very much. Well, while the Westminster government has faced widespread criticism over its handling of the pandemic, Scotland's First Minister Nicola Sturgeon and her government have both had consistently high approval ratings. But today, Scotland reported its highest number of new coronavirus cases since the outbreak first began, while the number of patients in hospital and those on ventilators has also soared over the last week. Our Scotland correspondent Kieran Jenkins joins us now from Largs in North Ayrshire. Kieran.
Kathy, as you say, the highest ever daily total of cases in Scotland recorded today, and even with the significant caveat that way more people are being tested now than back in the spring. Clearly, Nicola Sturgeon is worried. She says this is why she's introducing tough new measures. So here in sunny Largs in North Ayrshire, people until today could visit each other in one another's homes. Now that's been banned for the whole of Scotland with some exemptions. And it's prompted a discussion about Nicola Sturgeon going further than Boris Johnson. And into that debate goes not just the science but other issues too, about their record so far in this pandemic, about their messaging and about the public response. On the seafront in Largs, North Ayrshire, even the Viking statue is taking no chances. It sums up a country exercising caution as the numbers go in the wrong direction, far higher than just a week ago.
That's obviously a real cause for concern, but it also underlines why we took very decisive and very tough action yesterday to try to get the virus back under control.
So there's tough new measures. From today, no visiting each other's homes anywhere in Scotland. It means Catherine will no longer be able to see her mum in October, but she backs the ban.
I'm actually very grateful for the approach that our leaders are taking, and I even think about if I'm in a shop and I feel that it's too crowded, I just remember the advice from Nicola Sturgeon.
Nicola Sturgeon has gone further than Boris Johnson, and on this measure so has Wales and Northern Ireland.
So I think each of the leaders are weighing up the different interests that are being played out, whose voices are most powerful, and how much consensus there is across their political party and governments. And that's why we're seeing this divergence. It's not just because the science is different. It's not.
But are there more than policy differences here? Are there differences in tone? The punishments for non-compliance were a feature of Boris Johnson's speech yesterday.
There is nothing more frustrating for the vast majority who do comply, the law-abiding majority, than the sight of a few brazenly defying the rules. So these rules will be enforced by tighter penalties.
Nicola Sturgeon says threatening people is less effective than supporting them.
Let's pull together. Let's keep going. Try to keep smiling, keep hoping and keep looking out for each other. Be strong, be kind, and let's continue to act out of love and solidarity.
So has Nicola Sturgeon bought herself some space with the public to take tough decisions? Goodwill of the sort coming from Grandad Brian.
Well, personally speaking, I think all of the devolved nations have really got it correct. I think Nicola Sturgeon has done the right thing. We actually trust Nicola Sturgeon more than the English government, I'm afraid.
Polling in Scotland has certainly been known to show far more approval for how Nicola Sturgeon's handled the pandemic than Boris Johnson. That's despite a sobering number of deaths in Scotland. A recent international comparison showed neither country doing particularly well. On the key measure of how many more people died in the worst of the pandemic compared to the 5-year average, by the end of May, England had the highest overall excess mortality of 23 European countries. But Scotland wasn't far behind, third worst excess deaths of those 23 countries. In time, Scotland has taken some tougher measures than England, and over the summer, COVID deaths in Scotland fell to almost zero. But they fell considerably in England too. And despite some differences in approach, cases in both countries are now rising at a worrying rate. As for what comes next, an advisor to the Scottish and UK governments argues public behaviour around the UK will be crucial and it'll be based on trust.
Nicola Sturgeon didn't warn the public. What she did was to say she recognised that compliance is difficult and that actually government has got to work in partnership. And I think if you have that partnership working with the people rather than seeing the people as the problem, then compliance is far more likely.
6 months ago, the UK locked down more or less as one. Whatever differences there are now, there is also agreement that the threat of a second wave means the days ahead are critical.
Well, to debate the different approaches in England and Scotland, I've been speaking to the Conservative MP for Mid Derbyshire, Pauline Latham, and Dr Philippa Whitford, who's SNP MP for Central Ayrshire. I began by asking Pauline Latham what she thinks of calls for England to follow Scotland in a ban on mixing between households.
Well, I wouldn't be very happy about that, but we are doing all of this just to try to control the virus so that fewer and fewer people get it. But I don't really want to do any further measures if we can avoid it, but of course, if we have to, we will.
What's your reservation about further restrictions?
Well, because it's stopping people doing things that they want to do. I mean, I'd love to see my family, but if we can't mix households, then I won't be able to. And I mean, particularly at Christmas, that's going to be devastating for people. Nobody wants to do this. And I mean, not least Boris, he actually wants to free things up because he's a libertarian. He doesn't like this, but he's being given the information and he's had to act on it.
Philippa Whitford, Scotland has had much tougher restrictions than England, most of the way you've moved earlier than England, and yet today the highest number of daily cases in Scotland. So there's no real proof that all these restrictions work, is there?
Well, the proof was in the summer. I mean, we got our cases down into single figures through July and the early part of August. So, you know, that gave time for our test, trace and isolate system to get up and running. And it is managing to contact almost 99% of cases and 98% of contacts. They were able to get that system up and running when the numbers were low, which means it's much easier for them to actually cope with the rising numbers now.
Well, it has erupted again big time now, so in a way you had a brief reprieve, but you're back to square one almost, aren't you?
Well, I mean, that is obvious. This virus is incredibly contagious. The moment you take your foot off the brake, it starts to run again. So it's quite simple. The more we mix, the more we interact, and the more we are careless about how we do that, the more you will get the spread of infection. That's unavoidable. So it's trying to see how close can we get to degrees of normality, but not in a normal way. So accepting, cleaning our hands, wearing face coverings, it might be ventilation in offices or in pubs and restaurants. We need to look at how we can do things. We can't just go, right, we're fed up now, and now we're going to just go back to normal. That won't work.
So you're not one of those freedom lovers that the Prime Minister talked about?
Of course I love freedom. There is no government on the planet wants to do this. This is nonsense. But there's almost 1 million people dead across the world from this virus. And, while some people say, well, I'm choosing not to follow the rules, the person they infect doesn't have that choice. And the person they give it to might actually die from it. So it does actually require that everyone follows the rules, works together and protects each other.
Nicola Sturgeon's been one step ahead of the Prime Minister the whole time. Do you look up to Scotland and think, well, that's where we're going to be next week?
No, because it is different. I mean, Scotland isn't as highly populated as England, and we have different circumstances.
But has Nicola Sturgeon made a better job of it than Boris Johnson?
She's done it differently. I mean, she listens to the same science and she interprets it differently. And the same with Wales, the same with Northern Ireland. People are different and will interpret even the same information in a different manner.
Philippa Whitford, there's a lot of spin from Nicola Sturgeon about what she's doing, but actually, isn't the reality that you're crippling the economy by going further than England in terms of restricting people's freedoms?
Well, I disagree. I don't actually think people will come out and spend money if they're not confident that the virus is under control. I think it's the opposite. This idea that it's either you choose public health or you choose the economy, I think it's a false dichotomy. We need a maximum suppression approach, get it under control, and then you actually start to have bigger swathes of the country that, as Pauline said, have low levels, and therefore people are more confident to come out. I would just pick up one thing from Pauline. This idea that in Scotland we all live like a mile from each other in a cottage.
No,
you know,
I
if
didn't
you
say
look
that.
at Glasgow, the Central Belt, if you look at Edinburgh, we live pretty much cheek by jowl in our cities as well. And what has come out of our test and trace information is that it, at the moment in Scotland, is being driven by household interaction. And that's the reason why our First Minister has taken a stronger action on that.
Pauline Latham, doesn't England need to learn from that?
Well, we're learning all the time. We're in a much better place than we were in March, for instance, because we know so much more about the disease. We know much better how to treat people when they have it. So we're learning all the time. And I think, yes, we do need to learn from each other, and we have to make those decisions together.
Pauline Latham, Philippa Whitford, thanks very much for joining me.
Thank you.
Thank you.